Hey, hi guys, my name is Brianna and I'm with Baby Tree Surrogacy. This is the third video in this series. This will cover the psychological portion about why surrogacy is so important to have good psychological evaluations in the very beginning of their journey and why it's so important throughout. I decided there was no one better to explain all of this than the therapist that we use. I'm going to let her introduce herself so I don't mess anything up. Go ahead.
Okay, hi, I'm Dr. Jacqueline Reese. I'm a licensed marriage and family therapist. And I have been working with Baby Tree, it's a little over a year and a half, doing not just the psychological evaluations, but also the monthly screening calls, which sometimes turn into monthly or weekly therapy sessions, depending on what's going on with the surrogate. So I'm here to answer questions, anything you want to know.
So I wrote down a few questions that I think will be important to what people are going to want to know. But if at any point you have anything that you think would be helpful from your portion, even during my journey, you couldn't have, we couldn't do that together, all of my things throughout. So I really don't even get to see any more of the process than what the girls talk to me about, obviously, and what I know our steps are. But I don't get firsthand experience in that, unfortunately, because all the girls tell us how amazing you are. So the first question that I thought was important was to kind of break down what happens during an initial eval. Where does it take place? How long? The whole spiel that you would give a girl when she asks you that.
Sure. My personal preference is to do evaluations in person, but Baby Tree is growing so rapidly, and we have offices in different locations and girls that are in different states, so it's not always possible. So my second preference is video conferencing, video chat, or for us, it's more telepsychiatry or telemental health. And so more and more, it seems that we're moving more towards, the Zoom type of apps or the WeChat type of apps to do the evaluations more through video. And so because I don't have the luxury of seeing the girls in person as much as I'd like, it's really important to at least participate through video. Very, very rarely do we have extreme circumstances where for one reason or another it just couldn't come together, where I will do a telephone evaluation, but it's not very common. So in person or through video, the expectation would be we start out the session with me asking for some kind of formal ID. So I'm going to confirm that you are who you say you are, and then either take that in person or over the video, maybe texting. And then we're going to move into the evaluation portion. First part of it is called the mental status exam, which basically means I'm going to ask some really basic questions just to make sure that you are of sound mind, why you're here, what the intent is, what the purpose of the interview is. So the surrogates have a general idea of why they're meeting with me. Then we move into some history. So I get all ecology assessments. So I do family history, academic history, health, mental health, substance abuse, if it applies, neonatal on their own pregnancies. And then we go into talking about the support system of the surrogate. Because it's important to talk about what the plan is on who's going to be there to help and support the surrogate during a journey, which sometimes comes with experiences, whether they're related to the surrogacy or not, that could be the kind of stressors that would lead to some level of impairment. So we want to make sure that there's a good support system intact for that surrogate for many reasons. And then finally, we move into the risk assessment portion. It's not just an assessment of the risks in the surrogate's life, but it's also an assessment of how aware the surrogate is of the potential risks involved in being a surrogate. It's important that the surrogates understand what it all entails to be experiencing a surrogacy journey, especially for the ones who have never done it before. There are some gals that it's their second time and they are pretty much exposed and aware and they know, but there are others that it's their very first time and they come with questions and they're very welcome to ask them. So in general, that's the general overview of what the evaluation takes. About an hour and 15 minutes.
Mm-hmm. Do you have a preference? Do you just like to speak to the girl? Is her partner involved in that? Is it up to you or up to them in terms of if they have a significant other who's going to be a part of that journey?
I have surrogates ask if their partners can be a part of it, and I think that's great. Absolutely. If whoever they are comfortable with bringing in, especially if that's going to be a main support person for them, very open to that. There are other occasions where the surrogate presents herself during the interview, and something is revealed during that interview that makes me feel that it's important to maybe include the partner, and we'll have like a part B, part 2, and to get those questions answered, or to kind of assess the capacity of that support person, spouse, partner, whoever it may be, and the willingness of them to be a part of the journey, and to assess what their understanding is of it also, and the risks involved as well. So I'm very open to that, absolutely.
So the girl has passed her initial psych eval with you, and now she is pregnant, which is when they get to start seeing you again, is when they start contracts. So she's pregnant now. I mean, I personally have talked to you about this, that I think psychologists or therapists or some type of mental health provider, I mean, even a friend, if that's who you consider, your therapist, it's really good to have someone outside of surrogacy to talk to, even just for regular mental health. I don't think you have to have a problem to go to see someone in the mental health industry. And I think a lot of people tend to only go see a therapist when their marriage is falling apart, or they're depressed, or there's some big issue in their life, versus using it for regular mental health, to have a very healthy outlet to talk through any emotions you could be feeling. So during our journey, that's what they come to you for. They get to talk to you about anything and everything, whether it be, how their day was, their kids are bothering them, maybe, we all have ups and downs in our marriages. Everybody does. Maybe they're just having a really rough month with their spouse, and they'd love to talk to somebody about that who's not their spouse. As men and women, what is it? The phrase I heard growing up all the time, women are from Venus and men are from Mars. We speak two different languages. We don't communicate the same way typically in terms of our emotions. Women are like, I feel this, I feel that. At least my husband, as great as he is, he has 3 emotions typically, happy, angry, frustrated. He doesn't, for a woman, we're like, I've just not been feeling like you're talking to me the way that you should here lately. And they're like, what? And it's like, it's a tone. You're using a tone. Then think we're crazy. So right. I am a hard advocate for, making sure your mental health is taken care of even outside of surrogacy. I think it's a wonderful thing. Obviously, people must agree with me because there are a lot of mental health professionals. So I got people only come to you just because they're having an issue. And so during the surrogacy journey, is there anything in particular that you help them with regularly as it gets closer to the end of their journey? Do you kind of milestone with them in terms of, I know at the very end of a journey, you start walking the girls through how that offboarding process is going to work. So if maybe you want to mention the offboarding process and what you do to kind of prepare them for the end, other than obviously they'll be delivering a baby. There's nothing you can really do to prepare a woman for that. I think we all forget until it's happening every time.
Yes, I agree. Okay, so basically what I tell the gals, and I tend to share this during the evaluation so that they know what to expect. And what I say to them is that it doesn't really matter what the stressor is about. It could be related to the surrogacy. It could be personal. It could be related to their marriage. It could be related to being a parent. It could be related to the neighbor, or they're just annoyed at the guy at the gas station. It doesn't matter, especially because oftentimes there's not even a specific issue. With surrogates, it can be very biochemical. It could be very hormonal. It could be very related to, I just started this birth control and I've never been this sensitive. I've never been this weepy. Or from that to taking the injections and having a lot of irritability all of a sudden. Not for everybody. Everybody's different. Or being pregnant, and like most women who have been pregnant, realizing that oftentimes during pregnancy, irritability levels get can get very intense. So sometimes it's just about having a place to go where you feel that it's safe, whether it's in my office or over the phone, to just vent, like you said, with somebody who gets it, with somebody who's not going to try to say, oh, you shouldn't feel that way, or get a grip, or you're just being hormonal, with somebody who understands and who's going to say, just, you know what, this is the place. I've had girls come sit on my couch and weep for the whole 45 minutes. Just weep for the whole 45 minutes. And it's like, okay. And then feel better, just because that's what they needed. And they needed a safe place to do it. So it could be, there could be various reasons why somebody might either utilize that monthly screening for that, the one call a month, or request increased sessions because they need extra support. I know that they have their support people intact, but sometimes they need something a little different. And I appreciate that they can come to me and say, can I have extra support? Can I have more sessions? Or I'm having a little stress and anxiety, and can you maybe teach me a skill that might help me manage that? So we do a lot of that: relaxation, breathing, mindfulness, thought shifting strategies, the whole gamut, whatever. And I personalize it to the needs of that surrogate. Parenting skills, whatever it is they're struggling with in whatever area of life. We've had surrogates who, in the middle of their journey, lost a family member. Somebody had passed suddenly. So grief, anything that comes up where mental health and psych can help. I've had a surrogate say, I don't have a lot going on, but I've always wanted a therapist. So can we talk about whatever I want? Absolutely, whatever you want. Then moving towards the other part of your question related to discharge. So yes, once we get to early 30s, mid 30, week 35-ish, 34, we start talking about what next month's session is going to look like. We start talking about discharge. We start talking about what to look for related to postpartum depression symptoms. A little psychoeducation for the girls who've never had postpartum depression, about what to look for, what to notice. So that in that final session, which has to be, right now for the gals that are local, I require them to come in. Anybody who's at a distance will have to be, because I have to do a visual assessment also. That's going to be a very important part of this. And then I have measures. So we do, I ask questions, I scale the measures and score them. So that I not only use my clinical judgment, but the measures also reveal whether that surrogate is scoring high on a screening tool or not. So that we can move towards either adding additional sessions until the postpartum depression is resolved, or looking for evidence of the need for a referral for maybe a psychiatric evaluation, where a psychiatrist will determine whether psychotropic intervention would be necessary, assuming the surrogate's even open to that. So lots to discuss about, lots to talk about. I definitely share with them what to expect during that final session or the beginning of the post-delivery sessions, depending on where they land and how they're doing after the delivery. And we usually wait 3 to 5 weeks after delivery to have that session.
It's something we tell the girls during interview, because we do try and give them a very detailed first assessment with us too, in terms of what to expect during their journey. Even if we've already talked to them on the phone, we try and reiterate the big points. One of those being psych. We get asked so much by people who have never been to a therapist before why it's needed during their whole pregnancy when they've been healthy. And one of the things we always stress is we hope you stay healthy throughout your entire pregnancy. That is obviously the goal. We want you to not feel pressured or like your life is being invaded in. The reason that you can talk to Jackie, because we call you Jackie typically. Sorry if that's not formal, but we try and to them like that. Yeah. Is for anything we say that, yeah, if you're just wanting to call her and talk, or if you don't realize that you're starting to have symptoms of depression, because most people don't. You do not ever look at yourself and be like, I think, I'm starting to be just a tiny bit depressed during my pregnancy or right after. It's I have seen so few women recognize those symptoms upon themselves before someone else does. And so by having them evaluated, you know, every month through those little phone calls where you guys are just chatting about anything or everything, or they get to come in and see you, it's so important because it helps catch things like
Yes.
that as well.
There's
Yeah.
a little bit of formality during that monthly screening that you're referring to, where, yes, it's open to talking, for us to have a discussion, open discussion about whatever it is the surrogate feels she wants or needs to talk about. But the formal process, the formal part of that process is related to being able to gauge symptomology. So we always dedicate a few minutes to assessing depressive symptoms, and I go through and talk about what they might be looking like, anxiety, irritability, and overall stress. And I scale them on a scale of 1 to 10, giving examples of what a 10 might look like. What number do they think they're at? Based on how they respond to that part of the assessment in the screening, coupled with how they respond to the second portion, which is just tell me a little bit about what's going on. Any surrogacy related stressors? Are you having any personal relationship stressors? How is your support system? Are you taking the time for self-care, and what does that look like?
Yeah.
And how's it going with contact with the girls in the office? Do you feel supported by the agency? Because we want a lot of transparency there too. And I love it when the girls are open with me, even if there's a little bit of a hiccup around something, where they can say, well, yeah, I'm a little frustrated because this and this happened. And sometimes I can help bring clarity. Sometimes I can elaborate. Sometimes I can reach out to the office and say, you know, the surrogate seems to be struggling with something here, and how can we come together to help her? And then I think lastly, I talk about contact with the IPs. So the little assessment coupled with those inquiries about those areas reveals a lot. And so you're right. If that surrogate may start the conversation by, everything's great, there's nothing really I want to talk about, Jackie, thank you for checking in. And, you know, in their mind, it's going to be a 15, 20-minute conversation. And then we kind of start going into the inquiry. And then next thing you know, a surrogate finds that maybe she is having some intensity around a certain area. Then we can assess, how are you doing with this? Do you feel you're doing okay with this? Do you need extra help? Because ultimately, it's up to the surrogate. It's what the surrogate needs. So if the surrogate says, I would love extra sessions, then that's what will happen. If the surrogate's like, you know what? I'm being genuine, I'm being truthful, I'm being honest, but to tell you the truth, I got this. This is not my first time at the rodeo. I've been dealing with this kind of stuff for years. Here's my plan. This is what I'm going to do. Fine. That's great. If you change your mind, shoot me a text, give me a call, and we'll add extra sessions. If you don't feel you need it, no pressure. And that's just kind of the feel throughout the entire journey. We're here if you need us, but you're not obligated, whatever you need. So, yeah.
Yeah, I've never had a girl tell us by the end of her journey that she doesn't just love you. You know, I don't think I've ever heard a girl wait until the end of her journey. They do. They love you, which is something also during that initial interview. We're like, you will love her. She's amazing. It's wonderful. It's like, you know, this is the first time I've seen you since I left the other office, because I've mentioned in the very first video that I had previously worked in our California offices. So even just now, I'm over here. I'm like, yeah, I could talk to you about all of that. So I can help. It's contagious. You're that easy to talk to. But I do appreciate all the time you've given me. I think this is going to be great for them. The plan for these videos is to go through a whole series of everything that they could possibly need to know. We have it, in brochure form already, but not everybody wants to read the brochures. They want to see faces. They want to hear people. Me personally, I'm like you. I like this face to face. It lets me know who you are as a person. You see so much in the body language of somebody. So I'm loving this video series so far. I will let you go. I know you've got a busy day. Thank you so much for giving me.
Thank you so much. And any other questions anybody ever has, just feel free to reach out to me.
Thank you.
Okay, take care.